One of the muscles that we very commonly stretch in our treatment of low back pain is a muscle called the iliopsoas, or a muscle complex called the iliopsoas. It's a very common source of low back pain and tends to get tight from things like sitting for long periods of time or twisting or bending at the waist. It can get so tight sometimes that people may only be comfortable in a seated position. This is why some people may opt to sleep in a recliner rather than sleeping in a laying down position. Although this may feel good at the time, in the long run, it will continue to shorten the muscle, so that way it is more and more uncomfortable in the future when they're doing things like laying down in a normal position or even standing upright. It can also be a very difficult muscle for some therapists to treat. Traditional massage techniques aimed at treating the muscle have to work through the abdomen, so it can only access a small portion of the muscle when trying to work through the deep, strong, tight abdominal muscles. When people try to stretch it, they oftentimes only stretch the muscle into extension, but don't respect the muscle as a rotator as well. Other problems people run into when they try to stretch the muscle are being unable to stabilize the pelvis properly. In our AIS workshops, we aim to teach people, and therapists mainly, how to isolate, lengthen, and stretch every aspect of the muscle as a hip flexor and a rotator as well. In our clinic, we help our clients with this, and we also teach them how to keep it lengthened and stretched out on their own, so that way they're taking better care of themselves outside of our clinic, and we're empowering them to live their best life.